Hi folks, this is Dr. Burke with Pathways Integrative Health Center. Today I'm starting a 22-part series exploring the different patterns of poor thyroid health that I deal with in my office quite frequently. See, the traditional model only really looks at one out of those patterns, which really address only about 8% of the patients, who are dealing with the common symptoms of hypothyroid, which can be the weight issues, the fatigue, the brain fog, the aches and pains, the digestive problems, whatever it might be. I talk about different symptoms that are that are related to thyroid on different videos that I have. But the patient comes in to see me and they have questions of why do I feel this way and what's going on. So today we're going to start looking at some of the different causes. And the first four that we're going to talk about in the series are related up in the brain. We're going to talk to the first one is step one, which is poor hypothalamus function related to serotonin deficiency. Serotonin is a neurotransmitter or a chemical that makes your nervous system work. You might have heard of it. There's different medications like SSRIs that are designed to help deal with mood and personality disorders by keeping serotonin artificially elevated in our nervous system. What happens is the hypothalamus is the master control for your nervous system. And I talk in other videos of how a neurological approach to chiropractic care can affect hypothalamus function. I'm not going to get into that here. We're going to talk about some basics. So the hypothalamus tells the pituitary to release a hormone called TSH. So TSH is a brain-based hormone. That goes on and tells your thyroid to go to work, to make your T3 and T4 and start the whole process. So in that part of your brain, your hypothalamus is really, really dependent on adequate levels of serotonin. So if you have low serotonin, you have low hypothalamus, which leads to low TSH production, which leads to low thyroid activity, which leads to all the symptoms of hypothyroid. So the first question to ask is, what causes a serotonin deficiency? There'd be a lot of different causes we're going to hit to some of the basics. First one is hypoglycemia, low blood sugar. That can be from poor diet, that can be from chronic infections, poor liver function, stressed adrenal function, decreased B vitamins. Those can all contribute to hypoglycemia. Then you get the hyperglycemia. That's the insulin resistance or the frank diabetes where blood sugar is too high. So the swings up and down in blood sugar will affect serotonin production. Another big area is the gut. We make between 60 to 70% of our serotonin in the gut. We need things like tryptophan, we need B6, B9, B12, iron, all to form our serotonin. And if we don't have good absorption or we have gut issues, that's going to affect serotonin production. Last one is having too much serotonin. Like if we talk about taking different medications that artificially elevate serotonin in the nervous system starts to ignore it. It kind of tunes it out and doesn't respond. So what we see then is common symptoms of serotonin deficiency, things like depression, insomnia, fibromyalgia and chronic aches and pains, carbohydrate and sugar cravings, anxiety, IBS, panic, anxiety, mood disorders, poor motivation, hormone issues, PMS and things like that, obesity and weight issues, and migraines, and many other things. So those are some of the basics we see at the first step when we're talking about hypothalamus and serotonin. Stay tuned for some of our other videos. But thanks for watching.